I joke with my husband that it takes, a whole lot of courage and just the right amount of crazy to show up and to do this job.
Working in the medical field as a nurse or as a physician is stressful, and you need to be able to live your life outside of work and let those things go.
It's busy being a doc in a small town, from the worried well to significant trauma. You're infamous or famous depending on whether or not people like you.
I think I need change in my life. I think I need to switch it up a lot. I'm one part of a very big team in the ICU. It's always interesting. It's never repetitious.
I grew up in a military family, and my father was given the opportunity to replace General Dallaire as the UN Force Commander with the assistance mission to Rwanda. I had a sense of the conflict. I knew that their genocide had occurred, but it really wasn't until we were given the opportunity as a family to go and visit him there. Seeing children in the orphanages just feeling really useless. I walked away from that situation just never wanting to feel that way again. I just wanted to have some skill, something that I could offer, that if tragedy struck, that I could be of use, that I could be of service. And that's what led me to medicine.
As long as I can remember, it's all I've ever wanted to do, being a doctor. Ever since I was a child, I wasn't in a rush to do it, and so I didn't start medical school until 30. I work to live, I don't live to work. My family is my sole motivation, but it's taken work to get to that point.
I did have a friend who was quite sick when I was in high school and spent quite a few months in Children's Hospital, and my experience there was very formative. My memory of it really is of the nurses there, because they were the ones who we would ask our questions to. They seemed so smart and so competent and confident. I really just thought what they did was incredible, and as time went on, I think that was what motivated me to become a nurse.
In my early years, I probably would take a little more time to myself and not so much time to my profession. Sort of got caught up in academic medicine, and I noticed that when I came here. Physicians did dedicate themselves to their profession, but also they had a much better work-life balance than I'd been used to. So it allowed me, about the age of 40, to start focusing on my own interests.
Sometimes I wonder if there was an easier way for us to walk in each other's shoes from site to site and just kind of understand the intricacies of each site and the challenges that we face.
And so it's not always easy. Transport is the single biggest barrier to emergency department care in rural departments. And most of the docs on the island that you end up talking to get it. Sometimes the docs in the city like Vancouver don't entirely understand where you're phoning from, but I genuinely appreciate talking to docs from the island because they get it. They get how far away we are, and they understand what we have to work with.
Handling a big trauma or chest pain or a sick patient, that's what we're trained to do. The things that I find tough is what's going on with the patient that I can't see, the patient that I can't get to, that because it's a 5-hour wait, when it's not just the odd day where it's tough, when it's becoming our normal now to do hallway medicine. And big hearts hurt when that's the type of medicine that they're being asked to provide.
It goes both ways. I think the overcapacity is way more profound in Victoria and Nanaimo, and we don't see that, but we see this really sick person that we have here. There's 2 nurses, we can't run certain tests. We don't have a CT. So we feel this challenge when PTN says, you have to hold on to this sick infant for this number of hours, and you feel really isolated and alone, and it's scary at times. It's also kind of why we do it. We like the challenge.
Well, I think there's a balance. There's a balance between being empathic, trying to know where the families are coming from, but not to become personally involved. Because if you took everything personally, every person that didn't survive the ICU stay, you'd never be able to do it more than a week or 2.
You have to practice medicine in a way that you're not taking your patients home with you. And so you need to do on shift whatever it is that it takes so that when you walk out that door, work can stay there and you can be present with your family, you can be present with your people.
And so by making other aspects of your life a priority, I think it's better for my mental health overall. And it makes me a better doctor because I'm not stressed out so much. And I'm happier because I'm getting to spend time with my wife and kids doing things we enjoy doing.
To be good at your job, I think it's really important to take care of yourself outside of work. For me, being outside is the number one way that I do that. Exercise and breathing clean air just makes you feel better, relaxes you, like therapy.
Not have any interruptions, no one asking me questions, just being able to hit the trails is extremely therapeutic. And some days it's also where you process the bad stuff. Some days it's big sunglasses and I might be bawling and saying goodbye to patients during that run.
I love to travel. I love to go away and I love to come home. You get an appreciation for what you can do when you're in a resource-limited environment, and when you come home, you're more appreciative of what you have here.
I love everything about the island. It's a slower pace of life. People are pleasant. I think most of the doctors and allied health staffs that work for Island Health, there's a mutual understanding and respect for one another because we all chose to live on the island. So there's a certain camaraderie amongst that.
I think sometimes we get caught in our little silos of we see the pressures in front of us, and it's just that reminder sometimes that we're all busy. We all have sick patients in front of us and that we're all on the same team.